Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
So first, digoxin. Digoxin is actually a cardiac glycoside. So digoxin has two parts. One, we have structurally the digoxin has cardinolide nucleus, and it also has glycoside part. This cardinolide nucleus is responsible for increasing the force of contraction of the heart is by this cardinolide nucleus, whereas glycoside part is responsible for the pharmacokinetic activity of the cardiac glycoside. So this digitalis is mainly obtained from the part called as digitalis lanta, or it can also be obtained from digitalis purpura. Actually, the drug digitoxin is mostly obtained from digitalis purpura, whereas the drug digoxin more commonly obtained from digitalis lanta. Then, the first scientist who has described this drug is William Withering. William Withering is the one who has described the foxglove in 1785. Then, mechanism of action of digitalis. The digitalis will mainly inhibit the sodium potassium ATPase in a non-covalent manner. It inhibits sodium potassium ATPase in a non-covalent manner, and thus it will, whenever it inhibits the sodium potassium ATPase, it will increase the, sorry, it will actually, so the cardiac glycosides like digoxin will actually block the sodium potassium ATPase, uh, which is present on the cell membrane of the cardiac cell. So actually there is, after depolarization, after muscle contraction, the calcium which is present in the cell should go to its original position. So during depolarization, actually excess of calcium enters the cell through the cytoplasm, and even excess of calcium enters the cell through the endoplasmic reticulum also. So as a result, after the depolarization, after completion of the contraction, this calcium which has come from the sarcoplasmic reticulum should go back to its original position. Similarly, the calcium which has come from the cytoplasm should go out through the out of the cell into the cytoplasm. This is mainly aided by the sodium calcium exchanger which is present on the cell membrane. Now this sodium enters into the cell. This entered sodium should not be there in the cell, it should go out. So as a result, the sodium goes out and the potassium comes in by 3 sodium 2 potassium, that is sodium potassium ATPase pump. So now what does digoxin do? The digoxin will block this sodium potassium ATPase pump. If this blocks this sodium potassium ATPase pump, the sodium cannot go out. So there is less sodium gradient is present. So as a result, this calcium cannot go out of the cell. So this calcium gets accumulated in the cell. When more and more calcium gets accumulated in the cell, this increased calcium will result in contraction of the cell. So now there will be contraction occurs, depolarization occurs resulting in contraction of the cell, which will result in um, cardiac contractions, which increases the cardiac output. Now this digoxin will also have, okay, this digoxin also stimulates all the types of pacemakers. It stimulates SA node, AV node, and also it also stimulates the ectopic pacemaker cells which are present in the heart. So this stimulation of ectopic pacemakers is the reason for arrhythmias as a side effect of digoxin. So digoxin is associated with arrhythmias, has side effects.
Thank you and thank you for watching.